Hi everyone, this is Dr. Hatami. In this short video, we're continuing with the endocrine system and talking about the pancreas. Pancreas is the organ which has a glandular tissue, would be found behind the peritoneum. So it means this is a deep organ. Just you have to remove the stomach, small intestine to find the pancreas near to the spine. So that's the reason the pancreas would be located behind the stomach and near to the duodenum, the first part of the small intestine. But we learned the pancreas before in our digestive system and now in endocrine system. It means the pancreas has dual function. It's serving our digestive system by producing the digestive enzymes and also is serving our endocrine system by producing some hormones. So we can say the pancreas has both exocrine and endocrine portions. Basically, the most part of the pancreas is exocrine portion. So as exocrine gland, it has some cells producing the enzymes and a duct, which the duct is going to release the enzymes into the first part of the small intestine, which is duodenum. What are these enzymes? These enzymes are digestive enzymes, which can break down all type of macromolecules. So we're not going to focus on exocrine action of the pancreas right now because we are going to focus on endocrine action of the pancreas. So as endocrine portion, it has some cells, which these cells is going to make the structure which it looks like lighter under microscope, and it's called pancreatic islets or islet of Langerhans. So pancreatic islets or islet of Langerhans, this is the endocrine portion of the pancreas which they are responsible to produce the hormone. And these hormones basically regulating the blood glucose level. So the pancreatic islets compose of different cells, like we have alpha cell, beta cell, and delta cells. And these cells producing different hormones which have different function. Alpha cells producing glucagon hormone, which whenever the blood glucose level is low, so for example, you're starving and so then, or you're fasting and your blood glucose level is low, glucagon is going to increase the blood glucose level, return it to normal. Beta cells is going to produce insulin hormone, and insulin hormone is going to lower the blood glucose level, return to normal. So just imagine you had a sweet meal and now the blood glucose level in your blood is actually like higher than normal. So without understanding, insulin would be released and then they're going to stimulate all the cells in our body to take up the glucose, and then in this way it can lower the blood glucose level back to normal. And we have delta cells. Delta cell producing somatostatin, which this hormone is regulating and balancing the glucose and the balanced glucose and or glucagon and insulin level. So it means that it can regulate these two cells function to producing glucagon and insulin. Okay, there is a condition related to insulin and also beta cell, which is called diabetes mellitus. Many of you have heard this disorder a lot, or you have a loved one, they're experiencing diabetes mellitus, which the mellitus means sweet. For diabetes mellitus, which we have two type 1 and type 2 diabetes mellitus, in both they're experiencing high level of glucose in their blood, and even in their urine you can find glucose because a lot of glucose is going to be found in their blood, and then their kidneys trying to help lower it down. That's the reason we can find even glucose in their urine. So for both type 1 and type 2 diabetes mellitus, They have higher amount of glucose or sugar in their blood. But the reason is different. Type 1 diabetes is autoimmune disorder. It means that their immune system is attacking the insulin producing cells, it means beta cells, and then it's going to like dysfunction beta cells so they cannot produce enough insulin. That's the reason they require insulin injections. But type 2 diabetes is basically it kind of um, depends on your lifestyle. It's when the insulin receptors would resist bind to the insulin hormone. So we know that the hormone should bind to the receptor and then they can um, affect that cells to do their job, right? So that is this disorder is related to lifestyle. When someone always they are like receiving or ingesting the like carbohydrate, sweet meal, also the fat, and then often due to obesity, so they can experience insulin resistance. But the good news is that if they change their lifestyle and with like a little bit medication, they can get treated easily. What is the diabetes mellitus symptoms? So they actually the kidneys try to send the like sugar out so they can frequent they have frequent urination all the time. They feel thirsty, excessive thirst, and also fatigue and blurred vision are the common symptoms for diabetes mellitus. And also if it gets severe, it can get some complication like vision loss, kidney damage, nerve damage, and heart disease. And now let's finish this video with one question which asking which hormone is secreted by the pancreas when blood glucose level are low. So we know pancreas, the endocrine portion of pancreas is going to regulate the blood glucose level, right? Whenever it's low or whenever it's high. When the blood glucose level is low, pancreas needs to produce and release the hormone that can increase the blood glucose level, which that would be glucagon. Insulin and somatostatin both are production of the pancreas, but they act in different way. Insulin is going to reduce the blood glucose level, and somatostatin is going to regulate the insulin and glucagon production. Okay, and estrogen is even is not the pancreas hormone. Okay, thank you so much for listening.